Thank you. Can I ask all our speakers to join us up here at the head table? Thank you very much, Andrew. So this is time for us to switch over to a discussion with you, questions, comments. We have an online audience. Simon, you will let us know when we have questions from the online audience. We have microphones here. Please, the normal protocol. Tell us your name and your institution. And if you have a comment or a question addressed to a specific speaker, let us know that also. They are welcome to take whichever questions they want to take and address them in any which way. So why don't we begin on this side of the room, and there's a microphone coming your way. And if there are authors in the room and I have missed seeing you, please do also introduce yourself. Huh? Yeah.
I'm Karla Mejia. I work for the US Pharmacopoeia. And my question is actually, thank you, first of all, for the talks. Were very informative. I myself run away from microbiology because of the statistics involved in it and towards food chemistry. My question is for Cheryl Schneider, and I was wondering if the technology that involved in the portable labs was correlated with other confirmatory tests in the laboratories.
Why don't you go ahead?
Okay. Yes, the first year we ran double samples with a recognized food laboratory in Guatemala City, and then afterwards we've compared the results from the field testing with the results from the superintendent or the external quality control done on the deliveries. I think we only had one experience where the third party testing showed aflatoxin, and we didn't see it in the field testing, and so we requested resampling and retesting, and the second time that they had results that were within limits. So.
That's great.
You have a follow-up question?
Yes, actually, and it's more of a question related to risk assessment, because I saw that most of the views are from the private sector experience, except for obviously the World Food Program. And in terms of risk assessment from a regulator's perspective, you have to make basically a comparative risk assessment and put a priority list. And in a lot of countries, unfortunately, that because of the lack of information, there is not such thing of a comparative risk assessment. In the same way that a supply chain, private company would do, like Mars or others. So what would be then, in that sense, if you follow that train of thought, then you would have to think about the cost of the technology, the cost of any kind of control or prevention from the regulator's perspective within the framework of all the other things that you have to control, right? So what would then be your opinion, or what is your take? And this question is for all the speakers. Because it's so super challenging. I do capacity building on laboratories, and aflatoxins never comes up.
Okay.
And
so it's a great question, and I think you're absolutely right. From a risk assessment point of view, who's the person that's getting the risk? And if that's a kind of business, kind of agricultural risk, I think you might expect that they're the people who are willing to invest to address that risk. The question I would have is what can you do to encourage that investment? What can you do to encourage people addressing the risk? Well, regulation is a great way forward. And we find regulation very helpful. It's even more helpful when it's enforced. And that itself, provides its own challenge. But I think if you can form very active industry groups, very active partnerships with people who recognise that this is a threat to their business or to their livelihoods or to the development of their business, and then clearly there's a reason to address it. My hope would be that there's a way of taking that just from addressing a specific business or industry into addressing the fundamental, and Andrew pointed this out, the fundamental of how do you improve the basic agriculture. And I think that's the important thing. It's not okay just to take things, test them and reject them. At the end of the day, it's still going somewhere. These things don't get thrown away. They just get recycled. And so you've got to get to the fundamental of not producing it in the first place. And I'm sorry I've gone around the houses a bit, but with your competing priorities, I can absolutely understand why aflatoxin may not get there, but perhaps by engaging people who are much closer and to whom this is more at the heart of their business, they may be able to support some of those activities.
Do any of the other speakers want to come in? Laurie?
Yeah. I thought I would just comment that that's a great question, a great observation. And in fact, it does seem that the risk assessment paradigm has not really been applied to this risk, and would go a long ways towards informing policy, because of as we all know, that it occurs in widely varying amounts, and season to season, year to year, region to region. And so just some sense, better public sense of where the hotspots for risk are would inform better public policy in terms of addressing education or interventions, or engaging with the private sector, which David articulated so well. But yes, the risk assessment paradigm is badly needed, and integrated also with the examination of what the costs of changing the system will be.
Why don't I come back to the audience, and I also want to invite the panelists, if they want to ask questions of each other, this is also an occasion to do that. I see a hand over here.
Thank you for coming and talking about this important issue. My name is Jess Hum, formerly of Peace Corps in Southern Africa, and most of the maize there is consumed by the producing household. So getting these testing measures and control measures as close to the farmer as possible would be ideal. But I know from working with producer associations and cooperatives in Southern Africa that they don't have the capacity to do most of these things. Where do you think the best way to reach the end consumers are, keeping in mind that most of them are going to be producers and they're not going to be downstream in the value chain buying their food from supermarkets, but rather taking it from the fields, contaminated or not? Thank you.
You want to come in already, any one of you? John?
I'm happy to have a go at this. I don't deal with maize, so that as a caveat, but one of the things that I think needs to happen is we shouldn't just look at this from an agricultural extension perspective or a value chain perspective. Where we have GAIN or the Sun Initiative or other health initiatives, I think the extension workers who are looking at it from a public health perspective should work hand in hand with the ag extension people, so that the information that's provided to the household doesn't just look at it from the crop production and processing perspective, but from what happens to the household and its livelihood impacts.
Sharon?
I would just also like to add that our experience has shown that as you promote good agricultural practices, it will make your production in general more resistant from other problems, not only aflatoxin, but maybe different kinds of plant diseases and so forth. And it will also reduce waste at the field and the household level. And so I think sometimes we shouldn't take it only as an aflatoxin problem, but it's a broader problem in terms of food security, in terms of the quantity and the quality of food that is available for the final consumer.
Thank you. I notice we have, did I miss? No. I notice we have two hands up here. Valerie, do you want to go next?
Thank you very much for the great presentations. I'm Valerie Rowe with Catholic Relief Services. And I was really interested in learning about, especially the experiences in Guatemala and Malawi, of engaging the policymakers and bringing, I'm not sure, I don't know the countries very well, but what was their reaction to talking about aflatoxins and their acceptability and thinking about the policy side of it on that side? It'd be great to hear about that.
Well, I'll go first with Guatemala. With Guatemala, the whole P4P initiative concept has been readily accepted by the policymakers in Guatemala and has been included in the reformation and the amplified extension of agricultural services. However, aflatoxin as such has not been part of this, and it's unfortunately, we are getting much more feedback from the local industry and from the commercial sector rather than from the policymakers, just in terms of aflatoxin.
Andrew?
I would say that the experience in Malawi is different in that if I go back 10 years, there was next to no discussion about aflatoxin. And now we have the Malawi Partnership for Aflatoxin Control. And that sits under PACA, but that has been driven from government. And the discourse that we're having with government is linked to trade. So over the last 10 years, we've been talking to Malawi government representatives in London about what we're trying to do and the challenges that we're facing. And they have provided opportunity for different parts of the government to talk together. And I think the Malawi Partnership for Aflatoxin Control is very much that. It is about trying to get government and private sector to work together.
I had David Lambert here first, then I noticed two other hands also, okay.
Thank you. David Lambert, Iowa State University. The headline for me today is the connection between aflatoxin and stunting. I have never heard that expressed so explicitly. And it strikes me that usually when people talk about stunting, it's about micronutrients and animal source protein and issues like that. But if you can raise awareness on that connection, you bring in a very powerful new set of allies that you have not had before. It's huge implications for research budgets. Could you just expand on that a bit?
Shall we call on Jeff Leroy? Jeff is the author of the brief on stunting.
Hi. So I reviewed all of the evidence, there isn't a whole lot of evidence out there. And even though all of the studies, which are all association studies, point in the same direction, pretty much all of them have limitations in that they didn't adequately control for household poverty or socioeconomic status. And we all know that poor households face other problems than just aflatoxins in their crops. They feed their children diets that are deficient in essential micronutrients. And they also have children who are more exposed to infections. And we know that deficient diets and infections lead to stunted growth. So even though the evidence consistently points in this direction, I think we need more studies to say that this link is causal. What I conclude in the brief is we do not have to wait for that causal link to be established to take immediate action on aflatoxin control, because the link with liver cancer is very clear. And that's a sufficient reason to do everything we can to control this issue. If I can quickly comment on some of the policy and engaging with governments and working with farmers, I think we've heard positive messages, but there are risks involved in this as well, because once we open the black box of measuring aflatoxin levels, we also have to be ready to do something with contaminated maize. If a farmer now discovers that despite everything he did, his maize has aflatoxin levels that are so high that it's unfit for consumption, what do we do with this farmer? Are we ready to say, well, we'll swap out your dirty maize and give you clean maize because you participated? And does that provide negative incentives for the next season? Because if they know they get free maize anyway, why invest in better cropping and harvesting and post-harvest techniques? So it's a very thorny and complicated issue. And we're working in Kenya conducting a study, and every turn we take, there is a new challenge that we have to overcome. So we need a whole lot of very good thinking to attack this problem properly.
Thank you very much, Jeff. I had a hand up here. There was, I think, the lady back there. Thank you. And then I'll come over there.
I'm Sandy Hoffman from the USDA Economic Research Service, and my question actually kind of follows on this. While it obviously will not be important for households that are producing for their own consumption, I am wondering about the influence of the emergence of biofuel markets on this issue of diversion out of the human food chain.
Anyone wish to address that?
It's actually something we've started to think about. Is that a viable side flow that we could divert material into? We don't know yet, but we're doing some work to follow up on that. But my feeling is, and it's just intuitive, I honestly don't know. My feeling is actually that won't be viable economically, but we need to do the work.
We had a hand over there.
Hi, I'm Kitty Cardwell. You know me, most of you. I'm with the USDA currently, but prior to being with NIFA at the USDA, I was a research scientist in Africa. I was the project director that did the first study in Togo and Benin that associated blood aflatoxin with stunting. And I need to make a clarification. It's been stated several times that there were not good controls for socioeconomic status. There is a paper, which has not been cited here, by Sharif Egal et al., that talks about the risks of exposure and socioeconomic status. We did just 3 different analyses. We did the household head, and also the index mother, the mother of that child. And in our analyses, we discovered that only the socioeconomic status of the index mother was relevant to the child's aflatoxin exposure. And the conclusion that we drew is that aflatoxin is an equal opportunity exposure. Actually, in some zones, the children with higher socioeconomic status had higher blood aflatoxin, which we associated with discretionary income for purchase of peanut snacks. So we were able to show pretty conclusively and control for socioeconomic status in the regressions with the anthropometry that we did with the aflatoxin. And then, so I'm making that point. And there are papers, and there's another paper. You need to go find it. It's Sharif Egal is the primary author. And then I have some questions about both to Cheryl or David concerning the cost of analysis, because this really gets tricky. First of all, David was talking about 300 samples if you wanted a 90% chance of detection if you have low or aggregated sample problems. And I wondered, per ton, is that per ton? And then also, if you're looking at a village level or at household storage levels, not only is it the cost of the strip, which I'm interested in, the Neogen strip, but an estimate of the cost of the labor of getting that done, and also labor, the cost of replacement, the supply replacements in the blue box. Has that become a commercially adopted element? So that whole thing around cost of sampling is important, I think.
Can I go first with the 90%?
Sure. So, 300 samples for 95% confidence of a level of 1% contamination. Obviously, that's a low rate of contamination, and the 300 samples illustrates that you've got to take a large number of samples. The good news is, you don't process those samples individually, you can composite those samples. So those 300 samples could be composited to form one test, depending on how you take the samples. That's the difficulty. If you can put a flow of peanuts or a flow of maize through an auto sampler, you can end up with a nice little bucket of material that you can go off and then actually subsample and test. And that seems to work well. From a statistical point of view, we've looked at that, and that's a good way of doing it. But how do you get that material to flow through? And then once it's flown through, you've got it stored somewhere. And so coming back to the thought about, what's the side stream, what's the effective side stream for getting rid of contaminated material? Every time you handle it, you add value to that material. You add cost. You need assets to store. You need to hold it while you're getting the test result. And so it gets really quite complicated. So you can make the statistics work for you, but how you keep stuff hanging about cost effectively is more difficult, and also without creating more of a problem. I think the need for having reliable tests or test methodologies that you can take down to the field is clear, and there are some that I think work pretty well. I think you've also got to be very careful when you do comparisons between methods, particularly for mycotoxins, because you're dealing with this spotty distribution. You don't know whether you're testing exactly the same bit of material, whether it's a true positive or whether you've tested something next to it that's a true negative. And just because you get two different results doesn't mean to say that the tests are wrong. So it's actually quite a complicated setup to validate the testing procedures, but something that needs to be done. because one of my fears, and one of the things we've seen in some other areas of food safety, is that we get these great tests that are quick, that can, if you like, convenient, that you can take down to the farm level. But when you really look at them, are they as accurate and reliable as you would hope they would be? And sometimes they're not. I'm not saying that they're not in this case, but sometimes they may not be. So doing those comparisons is very important.
Thank you, David, for those considerations. I'm too a microbiologist in my earlier life. I did a lot of work on testing, and I think really in most of the cases with aflatoxin, the problem isn't as much the analytical technique, but really how you get the sample and how you prepare the sample, and that's really the big problem. Now, if you go back to the blue box, I don't have today's cost for the strips. The blue box, when I costed it the last time, was about $1,500. And again, the most expensive element there are the USDA certified sieves. So if you play off not having the round holes and use some sort of a square holed mesh, you can really drop that cost down. Now, in terms of the strips, one of the main problems is that the strips cost money to import them in from the States. And so the main cost can be, if you're ordering a small amount, can be the transportation costs and not the strips cost. But if you order too many, then they have a relatively short lifetime. It's less than a year. Probably by the time we get them, they're probably 9 months or 6 months, something like that. So that's one of our main problems. As I took into account the costs of the strips, plus the extraction fluid, plus the disposable pipette tips and all that sort of thing, the total cost per sample was around $5. And again, what we do are composite samples from different sacks, from the different farmers who are bringing the product in for the lot that is to be shipped out. Because of the different problems, not only cost, but also the lifestyle time for each of the kit components, we've been looking at alternate indicators of probable aflatoxin levels. Our colleagues in the local industry say that they use as a test for maize the percentage of kernels that show mold damage. And in the research from particularly from other parts in Latin America, they put a lot of emphasis on the amount of cracked grains or split grain kernels and chaff or powder or whatever the stuff that comes out with the foreign material. And so if we could use that as a reliable indicator, it would make everything much less expensive. But then again, you have the sieves that that the initial investment is so much higher. So, and WFP is not a research institute, so we'd be very happy to have people who have that as a specialty to support us in this area.
Thank you. Jeff, I know you wanted to respond. There's a mic coming your way, and then I'll come back to that. And then. Yeah.
Thanks for that lecture on sampling. I think that was very useful. But I think for individual households in smallholders, the sampling might be even more complicated, because if you make peanut butter, you homogenize, and if you get a reasonable estimate of the mean, you know whether a batch will pass approval or not. Individual households do not make peanut butter. They take a kilogram of maize or a kilogram of groundnuts and prepare that for the next couple of meals. So we don't necessarily care about the mean in all their sacks of maize. We care about the extreme values that we don't want the children, pretty much everybody in the household, to be exposed to. So if anything, I think the sampling is more complicated at the individual household level.
Thank you. And I'll come back to that side of the room. And then thank you for your patience.
Thank you. John Lamb from Apt Associates. I have a question for Cheryl and another one related for David. As we all know, any given crop can have more than one pathogen at the same time, and it's very likely that the corn shown in there also had a problem with Fusarium. Some of the best work on the possible linkages or interactions between Fusarium and, between fumonisin And aflatoxin is being done in Guatemala, as you probably know, by Paul Riley and one or two researchers locally, whose name I can't remember. So is it possible that by testing only for aflatoxin, you're actually allowing fusarium-infected maize to go into the system and go to areas where the people already have aflatoxin problems, and by allowing the introduction of more food that has a fusarium problem, a fumonisin problem, that you're actually accelerating the cancer-causing effects of the food that's being given to those areas? My first question. Because it's believed now that the fumonisins are a very powerful accelerator of the carcinogen effects of the aflatoxin. And a related one, David, if you wanted to source product from the farmers that are being tested in the method that WFP is using, would that give you a higher level of confidence, sufficient enough for you to be sourcing? Or would you need to have additional levels of protection? And how could you work with a WFP and donor-supported program to massively improve sourcing from larger number of farmers up to the level that you would need?
Okay. The combination of the problems of fusarium toxins and aspergillus toxins is something we've discussed extensively with Olga Toris. She's the local researcher for the project. We did not include it in our blue box because there were no quick field tests for fusarium at the time we designed the blue box. And also WFP uses as a strategy or as one of its principles that the purchase specifications have to be in agreement with local standards. And the local standards for maize do not include levels for fusarium. So that was why we have not included it in this test. Although, for your information, in Guatemala, chronic malnutrition for children under the age of 5 is very high. It's almost 50%, 49.7%, I think. And Guatemala has a high incidence, too, of, I don't know how you say it in English, spina bifida, which is related to the problems of fumonisin toxins. And so it is something that we are very concerned about. And again, WFP is not a research-oriented organization, but we would very dearly invite colleagues and sister organizations to look further into this.
So I think, I'm sorry, that was a really interesting question and a great answer. And I think, you know what, just a quick comment on that. I think you really got to start with the risk assessment. And really understand all the risks that you're looking to control, and also the kind of law of unintended consequences with what you do as well. Moving on to, what can we, and it's been raised a couple of times, it's very well talking about something at scale, but how do you take those approaches that work at scale and take it down to an individual farmer, an individual family? How do you make these things work? And I don't know how you do that on an individual level. I think if you can bring scale to these operations, you stand a much better chance. So what's the minimal scale that we can achieve? Is it through communities, pooling material? Clearly, training and good agricultural practice needs to be taken down to everybody individually. But then the kind of methods of validation, the kind of risk assessments on which fields are more likely to be contaminated year on year, which areas are seem to be less likely to be contaminated, which years are going to be worse, do we see that coming up, and can we put things in place because we know it's going to be a bad year? Those things need to happen more on a scale base. So it'd be really interesting to look at how we might bring minimal levels of scale and what those minimal levels of scale are to justify some of the interventions that we've talked about. And I think, we might be surprised, by how low that scale can be, and perhaps might be relevant for small communities.
Dorian, Andrew, did either of you also want to come in? Okay. I have JB over here.
I'm JB Codere. I'm with consultant with Mars. I'd like to make an observation, and then I have a specific question. I think the observation is important relative to stunting. There's no question that we don't have the conclusive, direct cause-effect relationship information that we might want or that we feel we might need. But I think that there certainly is enough accumulating information, and it is such a serious problem that is irreversible. And I would use as an example, in the late 1960s, a Chilean doctor, Fernando Mockingbird, developed what in hindsight, we would say is a rather crude methodology for shining a light through the skull of malnourished and nourished children to show the different size of the brains that were developing. He didn't have a slew of scientific data, but there was one person, Senator Hubert Humphrey, who was convinced enough that because of the nature of the problem, that that should be one of the justifications for the WIC program that was established in the United States. A little-known story. So the reason for saying that that we ought to make our own cost-benefit analysis, if you would, about looking at this association, I think it's important. Now, along those lines, to the question, I think Dave and I think Andrew touched on it in terms of the role of regulations or decision makers. And my question is this. If we look at the role that women play in agriculture, from the farm through the marketplace to the household and in the community, it seems to me if you're looking for a significant driver that you might begin to develop a module, whether it's training and development, providing tools and capabilities, education, or whatever, it seems to me that that might be an appropriate place to consider. So my question is there something out there like that? Has there been consideration that women could be the driver, and then has something been developed that could be used for that? And if not, why not? And then if it makes sense, what can we do to do something about it?
Okay, panelists, which one of you would? Andrew?
I'm happy to go first on this. In one of my slides, when I'm looking at ground-up production across Africa, the production didn't slump. And the question I have is why? And it is considered a women's crop, or has been. We're trying to understand what that means in Malawi. We're currently doing a piece of work with DFID, and we are spending some time with women farmers just trying to unpack how they are managing the crop, what changes to the farming system or the post-harvest processes, what impact will that have on them. We haven't got to the point yet where we're developing training materials, but at this point we're trying to understand better how it operates. There was a piece of work done in Uganda by the Peanut Crisp program, which you were going to. Well, if you know about it, please.
Go ahead.
Nelly Fezet, IFC. Professor Malika Junan, Virginia Tech, has worked with this program and with women organization to use them as a relay to relay the information, and he has documented an improvement into the percentage of crop contamination, because yes, that is true, it's a woman's crop.
Can you repeat the name? The microphone is not fully on at that time.
I will write it down and I'll give it to you.
Thank you very much.
And just for Jeff, when you say what you said is not always true. It changes from country to countries. In some countries, actually, households do peanut butter and do use it directly. In some countries, they don't. You can just generalize.
Tell us your name, please, before you put the mic away.
IFC, industry specialist with the IFC, Nelly Fezet.
Thank you very much. Did any of the other panelists also wish to pick up on this question? Otherwise, I will see if we have any last question, and then I will turn back to the panel. I have the last hand over there. Okay.
Hi, Vivian Hoffmann here at IFPRI. We at IFPRI are currently launching 2 new projects, one of them to do with aflatoxin, one of them looking from the consumer side at demand for tested aflatoxin-safe maize in Kenya, and on the other side, working with farmers, peanut farmers in Ghana to look at how incentives of premium prices, as well as access to technology, can result in the reduction, hopefully, of aflatoxin contamination of their crop. I'd be curious to hear the panel's perspective on the potential for the market, the very long, typically market chains that separates farmers from end consumers to transmit price signals in places where there's usually a lot of informal traders along the way. Is this a possibility even, or should we be thinking more about using direct relationships between formal sector buyers and farmers in order to establish those links?
Before you answer, what I'd also like to do is to ask each of you if you'd like to make a closing sort of remark, anything that you feel that we should be aware of, thinking about, working on, things that you feel have not yet been highlighted as much as you think they should. Please also take this opportunity to reflect on those remarks. But coming back to Vivian's specific question. Cheryl, do you want to come in?
I think at least for Central America, you must include formal and informal traders. Most of the maize goes through the different commercialization chains without getting to the industry. And so if you're not working with them, you don't. We also find that the commercial traders in the local markets have at least 3 different levels of maize and maybe 10 different levels of beans that they can sell at different prices. And so they are aware of quality. If you would test that, you would probably, because of they don't do aflatoxin testing, but they do look at grain quality, a level of mold contamination, cracked grains, and all that sort of thing. So I would guess that there's probably in the number 1 quality a lower level of aflatoxin than in the other levels. But I think that's a great opportunity for training and to include in any formal pricing system.
This has been a wonderful panel. I've really the very rich discussion and a sort of number of issues articulated and so forth. I would like to bring the panel to a close because we have an online audience, but I would like to do 2 things. I'd like to ask our speakers, as I mentioned a moment ago, any sort of final reflection, anything they want to highlight, either from this discussion or things they felt have been missing. And then for those of you who want to continue offline conversation, please do so. But may I begin in the reverse order, starting with you, Andrew, if you're comfortable, and then moving on further down that table?
My final reflection, I think, goes some way to answering your question. There are an increasing number of commodity exchanges in Africa which are providing some price signals. And that's fine, but they are self-selecting. I think we need to also look at things like warehouse receipting, where farmers can store their crops collectively, they can receive cash early in the year, and then they can trade or use the crop for their own use later. But the trade later on in the year will give them another price signal which will be quality related. So that might be something you could consider.
I'd like to go back to some of the questions that have been made on women's role in food safety. I think women have been the invisible link to many of the food chains throughout the world, and their special role usually is in sorting and in assuring quality of products, packaging, drying, shelling, husking, and that sort of thing. And I think all of the programs must take into account women. Many times we find in the ministries of agriculture in developing worlds, it's a very male-centered structure. And until women are included completely in this, both on the decision-making level as well as the recipients of information, we are still going to run into these bottlenecks.
Just really to add to a thought that Andrew put on the table, which is that and it relates a little bit to the last question as well, in that food safety really is a pre-competitive issue. And if you look in developed markets, people who've tried to develop a competitive advantage through having a safer product, that there are no examples where that's really worked. If people have food safety issues, it tends not to be one brand or one manufacturer who gets labeled with the food safety issue. It tends to be an industry. I think reflecting that into developing parts of the world, the question would be, can you charge a premium for safer product? And the answer is, well, only if there's a buyer who's prepared to pay for it. And that means addressing the waste, because the total system has got to be cost effective. And so finding something to do with material, because inevitably you start by sorting, and finding something to do with that waste material is absolutely key. Otherwise you lose so much of the economic effectiveness of the supply chain.
Well, that sets me up for my final comment would be to remind everybody, in the economics literature, there's been a debate about whether or not standards for food safety in international trade for food are a catalyst or a barrier. And I think part of what we've been talking about here today is whether standards or demand for improved quality can be a catalyst for improved quality throughout the system, or can serve to be a segmentation device. And so I guess I would hope that we can learn from our speakers and other examples going on around the world how to make it not a zero-sum game, but more of a lifting all boats in terms of finding technologies that offer promise to everybody in the food system. And wanted to close on this point and to highlight the upcoming technology event at ILRI, that in fact there are these strong complementarities between production, between higher yields, healthier crops, and reduced aflatoxins, and that right there offers us one possible way to move forward and not make it a zero-sum game.
Thank you very much, Laurie. And before I ask you to join me in thanking our speakers for really a very, very interesting, rich, substantive discussion, I also ask you to join me in thanking all the authors of the various briefs here. Jeff is over here, but there are many others around the world. And I think they've together contributed to this, elevating this discourse, and I think shining a light on some key issues and linkages and potential new work. So please join me in thanking our speakers and the authors.